This is the simple steps to save a life. Step-by-step CPR guide. Position your hand. Make sure the patient is lying on his back on a firm surface. Kneel beside him and place the heel of your hand off the center of the chest. Interlock fingers. Keeping your arms straight, cover the first hand with the heel of your other hand and interlock the fingers of both hands together. Give chest compressions. Lean forward so that your shoulders are directly over the patient's chest and press down on the chest about 5 cm. Open the airway. Move to the patient's head. Tilt his head and lift his chin to open the airway again. Give rescue breaths. Pinch the nostrils, close with the hand that was on the forehead and support the patient's chin with your other hand. Watch chest fall. Remove your mouth from the patient's and look along the chest. Watching the chest fall, repeat steps 5 and 6 once. Place your hands on the chest again and repeat the cycle of 30 compressions followed by 2 rescue breaths. Make sure the area is safe before you approach the victim. Your safety is your first priority, so before entering a potentially hazardous area, check for anything that might be dangerous. Try to elicit a response from the victim. First, introduce yourself and ask if they're okay. Third is check the patient's airway. Make sure that the patient is lying on their back. Gently tilt their head back, lift their chin, and open their mouth. 4 is check for normal breathing. Put your ear close to the victim's mouth and nose to listen and feel for breathing. 5. Start mouth to mouth. Tilt the victim's head back to fully open their airways. Pinch their nostrils close so that the air that you push into their mouth can't escape through their nose. Continue mouth to mouth until help arrives. If the patient's heart has stopped, perform CPR with the chest compressions as well as mouth to mouth. 7. Check to see if the patient recovers. If they begin breathing on their own, stop rescue breaths and roll them into the recovery position. 8. Stay with the victim until help arrives. Once you begin CPR or mouth-to-mouth, you are obliged to continue treatment until someone with the same or more training takes over. So continue treatment until the patient recovers or emergency medical responders can take over. First is full pin at the top of the extinguisher, breaking the seal. When in the place, the pin keeps the handle from being pressed and accidentally operating the extinguisher. The second, aim. Approach the fire standing at the same distance. Aim the nozzle or outlet towards the base of the fire. The third is squeeze. Squeeze the handles together to discharge the extinguisher agent inside. To stop discharge, release the handles. The last is sweep. Sweep the nozzle from the side to side as you approach the fire, directing the extinguisher agent at the base of the flames. After an A-class fire is extinguished, probe for smoldering hot spots that could reignite the fuel.